In this patient assessment, we're going to do a cardiovascular emergency, and this call is going to be we're going to call it to a site for a man with chest pain, and we're going to arrive to find a 50-year-old man sitting on his truck complaining of a severe pain in his chest. So we're going to do BSI, scene is safe. We're going to try to determine the mechanism or the nature of the illness, and in this case, it's a chest pain. There's only one patient, and we're going to request additional help as long as we have the resources. And being he's sitting on his back of his truck like that, we're not going to consider C-spine. And we're going to get a general impression from the patient. And like I said, he's a 50-year-old man and sitting on his truck holding his chest, and he's complaining of chest pain and nausea. His level of responsiveness, he's responsive, he's talking, so his airway's open. And his chief complaint's always going to be that chest pain. He's taking about 16 breaths per minute, and there's a symmetrical rise and fall of the chest, so we know there's not something going on deeper than we think that it is. And we're going to give an oxygen non-rebreather mask at 15 liters per minute. Then we're going to go into circulation, and we're going to assess and control major bleeding, but there is not going to be any bleeding. We're going to assess the pulse. It's going to be tachycardia, so it's going to be a fast pulse heart rate. And then we're going to assess the skin for color, temp, and condition. It's just going to be pale, cool, and moist. And again, with chest pain, we're going to identify priority of this as a high priority. Symptoms kind of went over. We're going to go into OPQRST. He was just working in his backyard. And provocation, he's just resting makes it better, so that's why he's sitting down. And the quality, can we describe the pain? It's just crushing pain in his chest. It doesn't move anywhere else in his body, so it's pretty localized. And the severity, he rated about a 3 on a scale of 1 to 10. And it's been going on for about 10 minutes. On the sample history, he's no allergies that he knows of. Medications, he has a nitro, and he took 2 nitros prior to our arrival. And pertinent past medical history, he had angina, so it's going to probably lead to what the chest failure is. Last oil intake, he had breakfast about 2 hours ago, and the events leading up, he was just working in his backyard, and he started feeling chest pain. We're then going to assess for the secondary assessment, and we're going to assess affected body parts in the system. So, being this is a cardiovascular, we're going to palpate the chest, and we didn't find any flail segments. Everything seems to be working normally. And then we're going to listen to the breathing, and it seems to be clear lung sounds in all fields. We're going to go in and get our vitals. His blood pressure, normal, about 120/80 mmHg. Pulse, we're going to say 94 beats per minute, normal again. Respirations, 16 breaths per minute. Then SaO2, 98%. And the field depression, probably going to say that he's having a cardiac event with respiratory distress. And the only thing we can really do, we're going to loosen his clothing so we can maintain the temp. And for EMTs, we can administer a 3rd nitro. And we can administer aspirin, as long as we're following medical protocols. And we'll also use that oxygen at that 15 liters per minute with the non-rebreather mask. Patient's going to be reassessed every 5 minutes. The blood pressure, the pulse, the respirations, and the O2 are all probably going to stay the same. But he's going to remain a high priority, being he's having that chest pain. And once we get to the hospital, we're going to hand that report off to either a nurse or a physician and tell them what we know.